Good day to everyone. Today I'm going to present our study entitled The Clinical and Nutritional Outcomes of Schistosomiasis on Maternal and Child Health. My name is Joaquin Isaguirre, and my co-authors for this study are Francis Cabaltera, Arienne Evangelista, Dr. Mary Jane Flores, Bridget Co-Arellano, Jessica Joyce Guia, and Mr. Frumencio. Next slide. As a short introduction, intestinal hematiasis to this day is the most prominent chronic human infection that affects more than a third of the global population. Amongst the many that are affected by this disease, both pregnant women and preschool age children are recognized to be the most vulnerable and at risk due to the increased nutritional demands of pregnancy and the growth and development of the children. One of the more prevalent parasitic infections is schistosomiasis, which is commonly associated with pregnant and lactating women, along with children aged 4 to 12 years old. In spite of the information that is known about this disease, less is known on the specific symptoms related to these infections in children and pregnant women alike. In developing countries where these infections and nutritional deficiency is common and very rampant, there's also limited information on clear treatment on specific micronutrients. Next slide. Now, to understand our study a little better, I'll be giving a short background on the life cycle of schistosomes, along with how they're transmitted into humans and how they cause disease. The abridged version of this life cycle is basically the eggs are released by infected individuals by open defecation or urination into local water sources. Myristidia hatch from these eggs and penetrate the bodies of freshwater snails. The myristidia develop further into cercariae and are released back into the water. An unsuspecting person obtains the parasite via skin penetration. The cercariae lose their tails to become schistosomulae and travel via a person's blood vessels into the portal vein of the liver. And the parasites mature into adults, pair up, and enter their final destination, which can either be the superior or inferior mesenteric veins of the intestine or the venous plexus of the bladder, where they eventually shed their eggs into a person's feces or urine. Next slide. So for the significance of this study, schistosomiasis is a condition that poses a significant risk to public health since it affects a considerable fraction of the human population. Very limited studies have qualified the prevalence of the specific clinical symptoms of schistosomiasis, especially in pregnant women. This study highlights the importance of establishing accurate knowledge on the connections between micronutrients and parasitic infections to create effective clinical interventions. And pursuance of this study can serve as an aid in the control and prevention of schistosomiasis, especially in endemic areas. Next slide. Objectives-wise, the study aims to determine the most prevalent clinical presentation of schistosomiasis among pregnant women and children of African ethnicity. We also aim to identify the most common micronutrient affected by schistosomiasis in pregnant women and children of the same group. And we're here to distinguish the different factors associated with the prevalence of schistosomiasis among pregnant women and children. Next slide. For the scope and limitations of the study, we were only focused on papers focusing on these specific characteristics. We only focused on only schistosomiasis, which was considered among the helmintic infection types. All studies had to be conducted within the African continent. Data from pregnant women of any trimestral stage were considered. Only data from preschool age children and school age children were considered, and only published literature sources from the past 15 years were considered for the systematic review. Next slide. To be able to conduct this meta-analysis, the following methodology was done. Starting with the research questions, published studies were searched from various online databases such as PubMed, Medline, and Google Scholar using the specific search terms. But in line with the study's scope and limitations, selection was further narrowed using the previously described inclusion and exclusion criteria. Upon choosing the studies, data from such sources were then collected and summarized into tables using Microsoft Excel. Finally, data analysis was performed using the PHTAP extension of Microsoft Excel. Specifically, a chi-square analysis with 95% confidence interval was done to determine the significance of the variables of interest. And if the variables were indeed found to be significant, positivity rates were then calculated to determine the most prevalent clinical symptom or affected micronutrient of infection. Lastly, the Cramer's V coefficient was also calculated to determine the overall strength of each relationship. Next slide. So here's our data for schistosomiasis symptoms for pregnant women. Essentially, our data shows that only 5 were identified from the many studies we went through, and these are anemia, diarrhea, hematochezia, abdominal pain, and dyspareunia. Results from our chi-square analysis show that there is a significant association between these 5 symptoms presented by pregnant women and the manifestation of schistosomiasis within the same group. Along with our Cramer's p-value of 0.4712, it shows that the data collected presents a strong association between these two variables, which indicates that these symptoms are highly likely to present themselves within an affected individual. As shown by the graph, the most common symptom would be abdominal pain since it had the highest cumulative positivity rate. But based on our analysis, diarrhea can also be considered the same since a follow-up chi-square test showed that it yielded a value that is close to the former. The other three, on the other hand, do not share the same recognition due to their lower positivity rates, indicating that these are the symptoms that are least likely to manifest among the five that were identified. Next slide. Now, the reason why these two symptoms, diarrhea and abdominal pain, are commonly observed among pregnant women is due to their behavior of traveling and settling within the GI area, which causes decreased water absorption, in turn causing feces to become more liquidy, and thus causing diarrhea. Along with that, there's also the inflammatory response that targets the parasites within, where a release of bradykinin would lead to pain to manifest within this area, hence abdominal pain. Next slide. So results for schistosomiasis in children are similar to that of pregnant women since there also exists a significant association between the 13 identified symptoms presented by the children and the manifestation of schistosomiasis. The Cramer's p-value also shows that there's a very strong association between these two variables, which indicates that these symptoms are also highly likely to present themselves within an infected individual. The graph shows that amongst the 13 symptoms, hematuria is the most common symptom being presented by these children. But once again, there are others that present positivity rates that are very close to the symptom, such as that of anemia and diarrhea based on the follow-up chi-square test. The rest, on the other hand, are less likely to manifest compared to the three that were previously mentioned. Next slide. Now, the reason why hematuria achieved a high positivity rate is probably due to the high prevalence of schistosoma hematoma cases that are concentrated within the African continent, with which their presence in the infected individual and their behavior of shedding eggs into the ureter and bladder would cause blood to mix into the urine that is to be excreted by the person. Anemia's high positivity rate, on the other hand, can be related to the parasite's behavior of ingesting blood within the vessels, leading to decreased amounts of ferritin within the child's body, regardless of the intensity of the infection. Now, diarrhea, once again, can be attributed to the behavior of the parasite, where it settles within the GI tract, where it can lead to decreased water absorption within the affected area. Next slide. Now, as for micronutrient deficiency, iron, vitamin A, and vitamin D were identified to be deficient among pregnant women and children with schistosomiasis. It can be seen that their prevalence varies significantly from one another, with vitamin A deficiency being the most prevalent, numerically speaking, and the other two falling short for the positivity rates. Separate chi-square test to verify the similarity of the prevalence of vitamin A and D deficiency was conducted since their positivity rates are closer, but it was found that there is no significant difference between the two variables. Hence, vitamin A deficiency is the most commonly observed. Despite the large differences in the positivity rates, deficiencies in vitamin A, D, and iron were found to be associated with schistosomiasis among pregnant women and children based on statistical analysis that yielded a p-value of less than 0.001. However, the strength of association was found to be weak using the Cramer's coefficient, which indicates that the manifestation of iron or vitamin A or vitamin D is less likely to be manifested altogether in one infected person. Next slide. Now, aligning the studies where we obtained our data, the results of our study found an association between schistosomiasis and reduced micronutrient levels, particularly iron, vitamin A, and vitamin D. And it's found that vitamin A has the highest positivity rate. To explain why this is so is because schistosoma settles in digestive organs, specifically in their venules, thus affecting the micronutrient absorption of the host, since these parasites compete for nutrients to survive. Our results showing vitamin A deficiency having the highest prevalence aligns with the study of Frisch et al., who was able to say the same thing when he found that increased C-reactive protein levels or CRP levels from parasite infection were able to reduce vitamin A reserves within the liver. On the other hand, iron deficiency was the least prevalent amongst pregnant women and children, which is opposite with the findings of Riley et al., who saw this deficiency to be amplified when the infection was found within individuals in their study. Since there's only a weak association between micronutrient deficiency and schistosomiasis, the contribution of schistosomiasis in reduced micronutrients can be considered very minimal. The varied results of this study suggest that more research is needed to provide a clear association between schistosomiasis and the impairment of micronutrient levels among pregnant women and children. Next slide. Results for the risk factors showed that amongst the 7 that were identified, only educational level and water source quality were linked with the prevalence of schistosomiasis within the affected communities based on their respective p-values. The respective Cramer's V shows different results, however, as the strength of the association is considered weak for educational level, whereas water source quality obtained a moderate association. This means that the contribution of the former to the parasite's positivity rates is very minimal, whereas the latter has a moderate contribution. Next. This essentially means being knowledgeable on the risk of schistosomiasis and the means to prevent its transmission, along with being exposed to contaminated waters, will lead you to contract the parasitic infection. Next slide. Low educational level or illiteracy would lead to greater positivity rates, mainly because it leads to a lack of awareness and concern with the risk of this infection and the means to prevent its transmission. Essentially, this means that if you lack the awareness, concern, and comprehension to understand this information, you're less likely to protect yourself from contracting the infection. Drinking or bathing from unprotected or untreated water sources such as wells, rivers, streams, and lakes leads to increased positivity rates, mainly due to the fact that its usage leads to a person to be vulnerable and exposed to the cercaria that are present within the waters. Next slide. So in conclusion, the most prevalent symptoms that were presented by pregnant women, which is schistosomiasis, are related to their gastrointestinal tract, while the symptoms of children have a wider spectrum ranging from anemia to hematuria. For the association of micronutrients among pregnant women and children, schistosomiasis had a weak significant association with micronutrient deficiency, having vitamin A as the most affected among children and pregnant women. And the most significant risk factors for schistosomiasis infection were low educational level and poor water source quality. Next slide. So as for recommendations for education, we recommend that there would be proper education through campaigns, seminars, and coordination with LGUs to spread awareness and knowledge on these specific diseases. Aside from this, there is the promotion of sanitary practices such as the wash principles and wearing protective gear to inform the public on how to prevent themselves from contracting the disease. And there's also the idea of the integration of subjects such as an early exposure to basic parasitology or a simplified form of it into the elementary to tertiary curricula, especially in agricultural areas, to at least ingrain this knowledge into the minds of the next generations so that it becomes common knowledge. As for interventions, we recommend that the cleansing of all immediate water sources to communities to eliminate the source of the parasite. There's also the execution of wash practices to again help them prevent themselves from contracting the disease. There's also the provision of affordable hygienic products and protective gear to the affected communities to aid the communities in preventing themselves from obtaining the parasite. And there's the implementation of affordable, enhanced, and periodic micronutrient supplementation programs to at least curb the effects of the micronutrient deficiency that occurs with the infections. Now, lastly, for research, we recommend that a similar study be conducted that utilizes data from the Philippines, and to conduct more in-depth primary research studies on affected areas to give a more accurate picture of the situation within the country itself regarding this specific parasite. Next slide. That will be all, and thank you for listening.